Folks, we got a newborn, a little tiny baby that's been having some feeding problems. In our clinic, we are blessed to have a body worker who specializes in kids, newborns, pregnant mamas too, but the outcomes have been spectacular.
This little cutie is a little over a month old, and he is congested. Little older brother has a cold, like most kids do right now. So babies don't have, and Dr. Paul's going to talk to you guys about this, babies don't have, their sinuses are not fully developed right now, don't have all of them at this age. So what I'm going to do, which I did not have already, is we are going to cup his little sinuses. So the reason that we're doing this is when there's congestion for these little guys and it affects breathing, with the way the nasal passages are right here, the way they run through, this gets congested. So cupping, decompression therapy pulls up on the tissue, like for backs, it pulls on myofascial tissue. What this does is this is allowing the tissue right here to come up a little bit, allowing the nasal passages to be a little free. So sometimes, like when we're done with this, Mama, you might get a sneeze, and he's pretty tiny, so I'm going to be really, really careful with it. But I squeeze and I put it on. Squeeze. Squeeze. And you can see a little bit of the pink. And you get the other side. Oh, buddy. So as you can see, it's not really easy. Remember, Dr. Paul, how we talked about sinus cupping and how babies don't have sinuses yet, but how the nasal passages can get clogged up. This little guy had yellow boogers. Older brother has a cold. So just do it a couple of times, and then that can help. It's a great way to help prevent sinus infections when kids do have sinuses.
It's so cute the way it goes.
I know.
That is the smallest.
They come in large sizes.
That is the smallest
They do.
little suction cup, just made for little babies.
Yeah, there we go.
And now we have happy baby.
And then just doing that a couple of times a day, and especially after you clean out the boogers. But a lot of times, again, because it's loosening this up in here, we'll get a sneeze.
Okay.
And it just makes it a little, you can almost hear the difference even afterwards.
Yeah.
And same for us when you do that. It really helps to clear that out. Yeah, did that make it a
So
little
did you
better?
come in to have your sinuses cleared up?
No,
No.
he came in to get a massage. In fact, guess what?
What?
This beautiful woman went away for the weekend, and so Mom and Dad took care of baby. And I showed her the technique when baby gets really tight remember I talked to you about just going up and down the spine?
Yep.
He likes being swaddled, but I'm going to take him out for a second. Yeah. He might get a little
We'll show the
messy.
technique.
Yep.
Perfect.
Yeah.
Folks, who knew that babies could benefit from massage? But it turns out this technique that you're about to see can really identify and release some of the tension that's along the spine. It can help things like feeding, like fussiness, a lot of the newborn stuff that we as pediatricians would never have dreamed could be benefited from body work. So go figure. Take a look at this.
Okay. So what I showed Mama, and then she was able to show Grandma, is you just push right along the spine. So I'm just kind of gently pushing right along those vertebral processes. So you can just see the little spinal muscles. I'm going to actually do it with this hand. It's a little easier. Yeah, do you remember this? So it's just a gentle push, 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 and I'm right along the line. This little cutie has been really, really tight. It's had a little bit of a problem with gaining weight and tension and stress in general because there's a little bit of curvature there. And because he was all squished when he was inside Mama. Yeah. So it just working out some of that tension. So for him right after, just the one massage last week made a big difference. So he's back for a little more of this work. I'm just working along that spine, and that can cause help him relax a little bit. Okay, let's get you back wrapped up.
Awesome.
Thanks, Noah.
There you have it. So thanks for watching, and probably, no, I was going to say don't try this at home. Of course you should try this at home. I'm just being silly. But no, seriously, if you're being gentle and you're being along those paraspinal muscles, is it true to say if you're gentle, you're not going to hurt anything?
No, you're not. No, what I do tell parents is if you don't feel comfortable, then you don't do it. And that is where seeing somebody who knows what they're doing first or a professional is helpful. But your baby talks to you. They'll let you know. If you're holding him, and it's like with him, he falls asleep in my arms when I'm doing this. So the idea is just being able to get them to let go and relax. If they start screaming and upset with you, then you're not doing something that's working. Whereas if it's working, if you're on the right spots, they'll relax. There won't be any movement, there won't be any fussing. The idea is that, and I'm just working from the top part of that spine all the way down. You want to talk to the camera and tell them how good it feels?
Feels great. I was just pointing out because she's pretty sneaky. She'll be working while she's talking.
Yeah.
Well, that's
There's
the whole
work
thing.
going on. There's work going on.
There's a lot
And
of
as a pediatrician or even as a parent, you're wondering, well, she didn't do anything.
Yeah.
No, she's working.
Yeah.
She's working.
Yeah.
We were just talking about that.
So the decompression work that Dee Dee was doing in older kids and adults, it's, sinus cupping, decompression work. Little tiny newborns, I mean, if you have any sinus at all, it's the tiniest little ethmoid sinus there, and sphenoids that are back kind of, you can't reach those, but the main ones, maxillaries come in around age 3-4, frontals around age 8 to 10 years of age. But somehow you've found, right, that just that little tiny bit of cupping can kind of open up passages. And when you're trying to breastfeed, if your nasal passages are blocked, then you put the breast in the mouth, you can't breathe. So it's helped that, right? I mean, that's what you're
and
finding.
even
so.
around like the forehead for cranial pressure, and it's not, and that again, that isn't something that can hurt them.
Awesome. Thanks, Dee Dee. That's a really good episode. Thanks, Mama.
Yeah, of course.